With this session update, I'm Shannon Lurkey. State health officials briefed the Walz administration and legislative leaders on the state's preparedness for the likely spread of the COVID-19 virus. They addressed the media following the meeting.
Okay. Well, thank you very much, everyone, for gathering quickly this morning. We've just had a really good discussion with the governor and legislative leadership just to continue to build upon our preparedness efforts here in Minnesota for dealing with COVID-19 disease. Obviously, we're all watching the news. We're seeing that we're having more cases in the United States, and that is getting us to just continue on the path we've been on. We've been saying for several weeks now that we're working to prepare for the potential of COVID-19 in Minnesota. And based upon what we're seeing, we do believe it's likely that we will see cases, and potentially in the fairly near future, just seeing what we're seeing in terms of the spread in Washington State and what we can learn from that experience. We do not at this moment have any confirmed cases of COVID-19 in Minnesota, so we're not here to announce cases. We are here to announce kind of our preparedness posture, and that we are working very closely together, and we so appreciate the legislature's partnership with us. I'm going to turn it over to the governor in just a minute, but just really again want to reinforce that we have the benefit in Minnesota of a strong public health and healthcare system that works on these issues all the time in close partnership. We're doing a lot to increase that level of preparedness now. I'm happy to announce to you that our state public health laboratory worked all weekend and is ready to start testing now. So as of now, we have the capability to do testing for COVID-19 in Minnesota, which will be very helpful to our efforts to quickly detect and then quickly manage these infections should they show up here. So that is important news. We have been ramping up our preparedness efforts inside of public health and with healthcare and inside our state agencies. We are using now what we call a unified coordination structure. It's one step short of the full incident command structure at the state level, but we are prepared to do that as well if and when needed. What the governor has asked me to do today is to convene a private sector leadership group to also help us think through community mitigation strategies if and when, as we think is possible, we begin to see significant numbers of cases in Minnesota as other states are now seeing. So with that, I'd like to turn it over to the governor, and I'm certainly available for further questions as you may have them. Governor.
Well, thank you, Commissioner Malcolm, and to your team for the work you did. Good morning, everyone. Thank you for being here. As you heard from the Commissioner, that many weeks of preparation have gone into this as COVID-19 has continued to spread throughout the world. Minnesota has been closely tracking this. Today's meeting was a continuation, and to be a very clear sign, I want to give great thanks to our legislative leaders who have been here asking all the right questions, representing the folks of Minnesota, and to make clear that the collaboration and the partnership between the executive branch and the governor's office, Minnesota Department of Health, and the legislators is seamless, and we're working together to make sure we get that right. I think that idea of having that strong public health system, and that's not just one person saying that I think that we understand that over many, many years of doing this the right way, Minnesota has a strong reputation. I think it's important to talk to people in Minnesota. Preparation is not panic. Preparation is the right thing to do. And I think we would be remiss if we didn't understand that, as the Commissioner said, this will get to Minnesota at some point, and preparation is the way that we are able to contain it, that we're able to keep the numbers lower, that we're able to make sure our healthcare system is prepared to respond to that. The testing that now can happen as of this morning is a really good thing. We're able to, and I think the numbers we had, we're able to test up to 100 a day. We have kits as we speak of about 400 able to do that. As you heard, our 5th case came back negative, so we have no cases as of now, but this will let us be able to extend that reach to make sure that we're able to detect as early as possible. And the internal coordination that you see happening inside of the agencies, you heard the Commissioner talk about, there are steps in that process of incident command structure and system in place. As we start stepping up, we're one step below, like where we stand up our emergency operations center. That's in the case of massive spring flooding, those types of things. I think it's important to note that we will be speaking at 11 o'clock with a White House briefing for all governors. Will happen at 11, and then at 11:30, the Minnesota Hospital Association will be here, because one of the things that the commissioner was able to convey to all of us in the briefing was, because of the seasonal incidence of flu, and it's running at a pretty high rate, that the beds in our hospitals are at a pretty high capacity as it is, and those are things we need to take into consideration if we start to see that curve go up with COVID-19. But I'm just grateful that Minnesotans have thought many years in advance. Grateful that in 2017 the legislature actually put in an account for exactly an incident like this, and there's money in that account. The federal government, we may hear more here at 11 o'clock, appears to be very aggressively getting ready to move resources to the state, and our system is set up to be able to handle that. So for Minnesotans to know the state is doing everything possible to make sure that we do our first priority, keep them safe, and when this incident arises, we will be there for that. I think what I'd like to do is let some of our legislative leaders maybe start with Leader Gazelka, say a few words, we'll go to speaker and have a few folks speak, and then work back for any detailed questions. So Leader Gazelka.
Well, good morning. I just want to encourage everybody that we are calm, we're focused, we have a plan. I appreciate that our president took swift action, and our governor with the House and Senate. Republicans and Democrats are also taking swift action in Minnesota. So we're not wringing our hands. It hasn't happened in Minnesota yet. We do expect it to come our way, and we're ready for it, and we know what to do each step of the way. And so I want to encourage people that you can be calm. You can be hopeful that we have a plan and that we'll implement it. And I thank for the governor for his role in this.
Thank you.
Good morning. I just want to thank the governor and the commissioner of the Minnesota Department of Health. They have kept legislators in the loop. We had a briefing on Wednesday last week. We had another briefing on Friday. I'd also like to thank Chair Liebling. She dropped a bill on Friday. She will have a hearing on Wednesday. The commissioner will testify and give updates as they have been sharing. The news is changing rather fast with this situation, but Minnesotans should be comforted that they have a very experienced and professional Minnesota Department of Health, and that every year the Minnesota Department of Health deals with the influenza going through the population, and that experience that they have in managing that very well in the state should make Minnesotans feel confident and comforted that we are ready for this. And it should also make Minnesotans think about their own personal practices that can help prevent the spread of cold and flu and COVID-19 should it come to Minnesota. It's really important that folks wash their hands, and it's really important that folks stay home when they are sick. We don't want to see any spread of the flu, and we don't want to see any spread of anything else. But I'd really like to thank the governor and the commissioner of the Minnesota Department of Health for keeping the legislature totally informed minute by minute as this unfolds.
Good morning. Thank you for being here. I just want to thank the governor and the commissioner and all the staff in the administration for all the work that they've put into this. This is not a partisan issue. We're here standing together because we want to make sure that Minnesotans know that we're prepared for this. And this is one of the things that Minnesota does really well, this sort of preparedness. So we appreciate being kept in the loop, and certainly we'll keep our folks and our constituents posted as we hear more. Thank you.
Leader Kent.
Thank you, Governor. I had the opportunity to attend a community event this weekend, and somebody brought up that they were hearing from their local school district about preparedness in our school districts, and that is evidence of this process working. This has been going on. Our Department of Health has led these conversations to help Minnesotans at all levels be prepared, to have a plan, and to make sure that we can all stay safe. I'm really grateful to the governor and to the other leaders that we are working together closely to make sure that Minnesotans have what they need to stay safe. Thank you.
Thank you, Leader. Maybe Commissioner come back up. If there's any specific questions or of anyone up here, we'd be glad to take them.
You talk about being prepared. People should be prepared. What does that look like? I know how you're prepared, but how should people in the state be prepared?
Thank you. I think this is exactly the key message. As we are preparing our systems, it's just so vital, as Speaker Hartman just said, for all of us to realize there are things we can do to protect ourselves and our families, but also to help with this community response. It matters very, very much that we all do what we can do to take care of our own health, to take those basic precautions. We talk all the time about covering your cough with your sleeve if you don't have a handkerchief, washing your hands way more frequently and way more thoroughly than maybe you usually do, and avoid touching your face. And be mindful of cleaning surfaces. So there are a whole set of really personal protection measures that we strongly encourage Minnesotans to take. We've also been talking about starting to think ahead about how you would manage illness in your family. And the key message, perhaps the most important thing to prevent community spread, is for people to stay home when they're sick. And we really do appreciate that is not always an easy thing to do, but it's critical that we be talking in the community, talking with our employers, really encouraging people to stay home when they're sick. And then in terms of preparing for care plans for family members who may become ill, children, what happens if daycare is not available. So those kinds of advanced planning activities, stocking up on basic supplies. We want to thank Minnesotans, actually, for taking these messages seriously. We're hearing about the stores running out of cleaning supplies and soap, and that's a high quality problem to have in the short term. We're certainly hoping and working with our retail sector as well to see if there's anything more that they can do and need to do on the supply side. But for people to be prepared of potentially needing to stay home for a little while if they or family members are sick, in addition to those really basic personal practices.
You mentioned that. Yes, sir. I was asking, is the legislative response necessary at this point? I know that there's a bill introduced for additional $5 million in funding, but is the response necessary at this point?
We really believe it would be prudent to have additional funds in that existing account. We, as the governor said, just based on more recent developments, we're more hopeful than we were that there will be federal support for some of our activities. However, that could take a while to materialize. We think it would be prudent to have access to the funds that have already been appropriated, and we're pursuing that right now. But we are going to recommend an additional infusion of state resources, which, as the governor indicated, could and would be repaid back into the state account if and when that federal funding came to us. But we do think it's prudent to add to the existing fund.
You said that there's tests ready to go. Could this increase recently be the fact that people are simply being tested, and there are cases out there right now that simply haven't been tested? How can you respond to that?
It's an excellent question, and indeed that is part of the story. What the folks in Washington State believe is that since they've been increasing their testing, they're finding more of what was already in the community. It is certainly possible that other communities will see the same thing. Once we begin testing, we'll find more. There's actually a bit of a silver lining in that. If that's the case, that it's already circulating and has been undetected for a few weeks, what that suggests is that, and we know this to be true, the majority of the cases are mild. But we all owe it to the vulnerable folks in our state and in our communities to do what we can do to prevent the spread of this disease, because for some populations it's quite a bit more severe and has the potential to be fatal, unfortunately, as we've seen. So it might not be a big surprise that when we start testing, we find that there is a background level of disease already circulating over these past couple of weeks as the global spread and travel from other countries other than China have continued to pick up.
Commissioner, what had to go into then preparing this weekend's work to be ready to test for this? I mean, how much work is that to convert that?
Really grateful to our public health laboratory staff who, as soon as they received the improved or repaired test kits from the CDC, they had to do a whole bunch of tests to validate that they could get the same results as the CDC, a validation phase, which they took very seriously and worked throughout the weekend to make sure that they could validate that the test kits that we received are ready to go. And they just let me know that this morning at about 9 o'clock.
Commissioner, how many test kits do we have here in Minnesota right now ready to roll out? And is there going to be a process for deciding who gets tested? Because many of the symptoms are similar to, say, the flu.
Yes, thank you for that question. There's a difference between how many samples one kit can process. So I think we have the capability to test about 400 people today. It doesn't mean 400 kits, but 400 of the correct, compilations of chemicals to do the testing. And it is a little tricky, and part of why we might not be surprised if we find COVID amongst the other strains of influenza and respiratory diseases that are circulating, because the symptoms are quite similar. The CDC continues to be a really important source for us of guidance on who to test, what particular clinical symptoms really justify a test at this point, because we have to be a little careful about making sure that those tests are used on the cases that have the most probability of detecting this. So that will be something that we're continuing, and just this morning we sent out to healthcare providers around the state sort of some updated guidelines on who to test, and we've been having a very strict standard around connection to travel with China. That is what is sort of being loosened up now, so that if you have the underlying clinical symptoms, the travel criterion is not the rule-out criterion that it was before.
Spring break is coming up. Should people be adjusting their travel plans?
That's the sort of thing that we will continue to be in close dialogue with CDC and other states about. At the present time, the CDC continues to say, and we continue to believe this to be true in Minnesota as well, that for the general public, the risk remains low today. But for at-risk populations, under certain circumstances, the risk is quite a bit higher. So we're not seeing today the need for people to cancel regular travel plans domestically. That could change, but that would only be a determination made as facts change and as we get additional guidance from the CDC.
The vulnerable populations, what about nursing homes? We've definitely seen that Seattle, we have a high aging population. What's going on in that area?
Yes, that we know from the experience in China and other countries that the severity of the illness and the potential for illness to be severe and require intensive medical care is quite a bit higher in the elderly than it is in the general population. So we've been concerned about long-term care facilities and in close dialogue with them. The long-term care associations have been participating in our regular calls with the healthcare system as a critical part of the healthcare system. We're going to be kind of increasing our focus there and our direct communications with long-term care providers. CDC just yesterday issued some updated guidance for places like daycare and long-term care. So we're definitely focusing both on kind of the acute care system and the long-term care system as well.
And assisted living, it's less regulated.
Correct, but we certainly do have the ability through home care, licensure, and other things to be in communication with assisted living as well. So right now these are not regulatory measures we're taking; they're consultative and joint preparedness, joint planning efforts that we're doing.
Governor Inslee has declared a state of emergency in Washington. I know it's too early for that here. What would that look like if you got to that point?
Well, that's what the commissioner's talking about. That's what this process is, as we start to step them up and understand that what the authorities are for quarantine, for example. We're coordinating in this with this external task force that the commissioner will lead is meant to do, because we have to think, as you said, you have from spring break to baseball opener when you put 50,000 people in a confined area. So our system is set up, and those are the decisions that are made as we pass through those gates. It's most important to know, though, that system is already there, and we can start to adjust accordingly, and it will be situation based.
How quickly will the House and Senate bills move through the process, and are there differences that have to be worked out? Or?
That is clearly not my area of expertise, so.
Well, yeah, Tina Liebling, Chair of the Health and Human Services Finance Division in the House. We are having a hearing on Wednesday. I have a bill put in. I understand there's one in the Senate as well. Ours has a blank appropriation. because we're waiting for a more precise estimate from the Department of Health on what their needs will be. And I do want to make one point about that. Someone asked about the legislative response. I think one of our goals would be to not have to come back into special session should we have more needs. So one of the things we want to do is plan for a longer period of time. Of course, you want to be sure that you have enough to meet any reasonable expectation of need. And if we plan for too much, that's fine. We can adjust that later on. But I think it would not be a good thing if we did end up in a situation of greater need in the state and then the governor had to call us back to appropriate more funds. That's something we'd like to avoid. We have a very good fund. It has great parameters for exactly this kind of need. And so if we put enough resources in that, I think we should be fine.
One more question.
I would just,
if we need to.
yeah, and I would just follow up on this piece. That's exactly right. The legislature, our responsibility to them is, and Commissioner Malcolm and the team is putting that together, we will submit a proposal to them and let them do what the system does, debate it. I do think it's important, though, at least the way we're looking at it now and the way we understand it, the federal response will help us reimburse that account back to the state. And I think those are the things that the legislature needs to know ahead of time. I appreciate them looking at it. The blank account does not mean a blank check. It means they're waiting for us to come up with those reasonable notices and for us to watch what the federal government's response is going to be to us. So my anticipation and everything we're hearing here, once those things are in place, that's relatively quickly.
Last question.
One thing I would just add that we are going to be looking at in the House the authority that the governor has under the disaster contingency account and look at whether we're treating a natural disaster different than a public health emergency and make sure that the executive branch has the authority that they need under either set of circumstances to react rapidly.
I appreciate that from the speaker, and I think I spoke with Leader Gazelka and the Leader Kent on this. I think once we move through this, that is an important point. We used to have that in Minnesota statute, and it was removed, and I think it's worth bringing that discussion back so we're able to move. So,
Commissioner, one last question then. Regarding testing, the CDC still does have some travel history related to its testing advisory. Are you saying that Minnesota's going to be a little more liberal in its testing capacity and choosing who is tested?
You know, I think that we'll stay in close contact with CDC about their suggestions for testing parameters. They have been indicating that they want to give a little bit more flexibility to state health officials to adjust those criteria as situations evolve in the state. We do, it will be important to kind of combine the clinical information with what we know about the person's contacts with others who've been traveling, but being aware of how quickly the spread is happening. I just also wanted to say again, to echo our deep appreciation for the bipartisan interest in this issue and the willingness to work quickly. That, as is currently scheduled, there'll be hearings in both the House and the Senate on Wednesday of this week. Senator Ralph has a bill as well, and it's just really, really gratifying that we're preparing to move really quickly on this.
All right, I'm going to leave my final statement to all of you. The coverage of this helping Minnesotans has been fantastic. The ability to get out factual, science-based information in a way that is preparing them without panicking them. We are really grateful for that. This is a case where we have to work in close contact together to get this information out. So I want to just say that on behalf of the administration, we are really grateful the way this is being covered. We will make sure that we're keeping you as quickly informed as possible because that's part of the public health response, how quickly they're able to get this information. So as situations change, you need to be there on the front to do that. So thank you all. Thanks, leadership.